Yes, you're gonna have people turn their backs, but it's time for us to keep it real. Just keep talking that real, bro. Do what you do. I know what you do, so keep doing that. Talk the real.
The HBI lads will see you now. See you now. See you now.
I don't want to cause no problems. I just want to live my life, but I keep on hearing about nonsense.
And we're back. HBI Podcast, Health, Business and In Between. My name is Dr. Nathan Bridger. I'm a chiropractor and strength and conditioning coach working out of North Fremantle, Western Australia. The place to be right now, frankly. And we're speeding up the roll call here because it was getting a bit weird. So I am joined with the trio of assassins themselves, Mr. Mina Garris, Mr. Ben Humphries, and Mr. Dr. Daniel Kirkbride. You can all be doctors if you want, I think. Who cares? We're all real doctors, right? And there goes the tumbleweed. But joined by the boys this week, we are discussing modalities. That's right. Don't tune out just yet. But where this came from is how often do we get asked, what does an adjustment do? What does cupping do? What does dry needling do? How does soft tissue work? All these kind of things. And today, we're going to try and hit it head on. We're going to talk from a bit of a more scientific point of view, from a bit of a general understanding point of view, so that when you want to know, you have a place to go. So I know it's the usual suspect that led this one in. So let's talk to the man with the mullet, Mr. Ben Humphries. Where are we starting at, mate? What's the one? I feel like it's going to be cupping because it's the one he comes most flack for. So let's talk. Should we just start with cupping?
I think we just, I'll lead in with a little bit of an intro, but yeah, we'll start with cupping and then because we all of us use a lot of different techniques, right? Whether it's cupping, was that vacuum cupping, fire cupping, dry needling, electrode dry needling, you've got scraping, you've got deep tissue massage, you've got joint mobilization, you've got joint adjustments. And if I missed anything there, then you got some chanting, some voodoo shit as well.
You gotta slap some fish around,
All right. So I'm speaking for all of us here, and probably this is for the practitioners in general. How many times a day, do you get asked what does certain types of treatments do? I'm assuming you boys have been asked a lot.
100 times over.
Yeah. Are you boys sick of telling people what it is?
Sick of telling people still asking what a myotherapist is.
While they're face down getting a treatment.
Yeah, I love it. But yeah, no, we get it all the time.
Well, we've got who to see and when to see. That's one of our podcasts already. That's live on which practitioner to see. So that should answer all the questions on episode, I don't know, 5, I think it is.
Episode 4 or 5, I think, yeah.
You got to speak up, Nate.
That's how many episodes we got now, mate. I can't even remember. It was so long ago.
Oh, man, I'm working hard. All right. So cupping. What does cupping do? I know Mina does it. Daniel does it. Nathan, you do it as well now.
Yeah, I've got a little bit. I do a little bit of those sort of self cups and which I've found. I ran it. I was like, you know what? I've heard it talked about so much. Let's trial it. And to be honest, I've been quite happy with how it's added into the skill set. Yeah. I think the best way to start here is to talk a bit about what cupping is and the different types of cups, then talk about sort of how it works. Because for a lot of people who may not have experienced, they probably have no idea what we're talking about. And judging by the video Rule Arm put up the other day of someone using a candle and a pint, it just seems like a lot of people don't know what's going on. So that seems like it's a quick way to get yourself glassed. But do you want to talk about sort of the different kinds of cups and then talk about or the different styles of cupping and then talk about how it actually works?
Yeah, I'm happy to run with it. As a physio, I'm relatively, not new. If you look at my accumulated hours of cupping, it's a fuckload now. But in the chronological time period, I haven't been using that long, but I love them. Now, cupping, I started off with just vacuum cupping. So you just got plastic cups with a handheld pump, which basically pulls the pressure out of the cup or pulls the air out of the cup, which creates a negative pressure within.
For those on the visual podcast, Mina is holding it up now. That's not just some weird dildo.
It's a fucking bondage toy.
Plastic cups.
Yeah, so basically the cup, it's got a valve at the top. The gun will pull the air out and make it basically create a suction within the cup, which then, is on your skin, and it basically makes your skin held tight and very creates a very decompressive effect on it. You can have your fire cupping, which is works on the same sort of principles. It creates a vacuum again, negative pressure within the cup. Then you place it on the surface, it seals the area and then creates the pull on the skin. So I'm a massive fan now of fire cupping. It's unreal. I don't know. I basically have been using the plastic cups up until about 2 months ago when my plastic cups have now got dust on them. Like I barely touch them. And I find that people definitely do prefer the fire cupping once they've had the fire cupping done. But that's it for me.
Let's talk
That's the
baseline
types.
then. So that's the types. There is, I think, the third type, which is the one I use, which is a self-suctioning cup.
Sorry.
Yeah, the silicone cups, which is sort of, I think, one of the newer ones.
Yeah.
And they're just, for me, it's just ease of use that sort of led me down that pathway. So we've got, obviously, they all create a similar idea that we create a vacuum on. Let's talk about the actual purpose of putting the cup on is, and then let's talk about what potential differences you might get from, I guess, the sort of suction one versus the fire one. I'm just gonna pick someone here. Let's go, Mina. Mina, why do you use cupping? Like, what are you trying to achieve by using cupping?
So again, just always remembering when we use any form of modality, making sure we've checked that it's appropriate to cup, because not in every single situation you can use cupping. But in the event that we can use it, I use it with a conjunction with other modalities as well. So we look at releasing tight fascial bands, we look at releasing tight muscles within the area, and we also use it mainly to generate, and when you look at how cupping works, so basically when we put a cup onto the muscle, it desensitizes the area, it creates more blood flow to that affected area, and we pinpoint them on specific spots, which we call trigger points, or you call knots in general, and we place them on those specific knots, and we break down basically the tightness and increased blood flow to the affected area. So why do we use it? There's a few reasons why we use it. So some people have like limited rotation, who have damaged tissue fibers, and basically if anyone's got restriction in their range of motion. So for example, we use things like functional cupping, where if someone's got a restricted flow, we put the cups on the area to increase mobility and range in that certain section. So there's a few different reasons as to why we use it, but that's the broad reason as to why we use it.
And what about you, Dan? Like, I know you do a bit of cupping as well. Where do you sit with that?
Yeah, similar to me. I think so. I started the opposite of Ben. I was into the glass cupping initially, and then I think they have very, very similar effects. Like personally, anecdotal feedback on myself, I think the glass ones definitely feel nicer, and a lot of people tend to say that as well. And the suction's a lot tighter. I think as a practitioner, though, in terms of ease of use, not having to whip out this little lighter and your methylated spirits, and then the cups don't suck on as consistently as when you use the gun. So I think from a practitioner point of view, using the cups just tends to be easier versus the glass ones. In terms of what I'm doing it for, similar to Mina, I guess, like desensitization is the first one. So just trying to alter that input, to get a little bit of a short-term effect on pain, but also then looking at flexibility from a passive point of view before then like transitioning from passive to active and prescribing, more active, training modalities, exercise, rehab, that sort of thing. So almost just a way of opening the door to then being able to do the long-term interventions.
Yeah, good point. I'm happy to chip in there. Now, we all use them for symptom relief, right? So pain relief, we use them for functional improvements, we use them to facilitate healing. So I think the main points there are that, depends on what preference, right, on ease of use. I find that like the fire cupping, like if you get it all set up well, like it's sometimes a bit quicker. Once you get the ball rolling, it's quite good. And the added warmth creates that extra bit of like vasodilation, right? Opens up some of the blood vessels. But I find, the best benefits, as the boys said, what actually happens if there's a bit of pain relief and there's a bit of symptom relief, what is actually happening? You get the desensitization is the activation of the descending pain pathways to get a local release of analgesia, right? So people get that numbness. And I find that not the numbness or the partial numbing, the partial analgesic effects. I find that once there is some pain relief, then you're going to get improved function anyway, because you get an increase in the muscle function, and you get an incidental increase in the functionality and the range of motion, active or passive, whatever it may be. But yeah, I think another big benefit I see from the cupping is the decompressive effects it has on the tissue. So I find it's really good for, which I can explain a bit later on, but really good for facilitating healing. That's one of the main reasons I use them for.
Yeah, like I'll jump in through there. Like the only thing where I've added it in is usually if someone's very acute, it's a nice way to get in an
Sensitive.
acute area without being too aggressive. And I have found anecdotally so far that if I use it in an area like, say I've got someone who's real tight through the thoracics, I might just throw some cups on, go work through the hips, do a bunch of soft tissue release and mobilization work there, then come back. And I tend to find at times it's facilitated the adjustment a lot easier because we've got a bit of desensitization. Obviously, it's usual things, right? Like changes in muscle tone through, stretch reflexes and then blood flow allowing better mobility and movement. Anytime we've got an increase in blood flow in an area that we're not getting good movement, we could potentially have injury, it's going to do good things for healing. So it's a very simple process. And I think we'll probably find as we go along today with a lot of the modalities, the idea is very similar, right? Like it's just different ways of getting into it. And in my opinion, I think this is one of the things we'll also see, all of us have, I think we already mentioned it. I don't think I've ever, and I don't think probably anyone here has ever just cupped someone, right? Like it's always in combination with other things and as a gateway through. Like it's like manual therapy in general. It's a combination effect to assist the body so then we can have more active strategies around that as well. It's a combination. It's always combination. And I think this is just hitting on that more science side of things where people want to have this study says this study says that. It's like, yeah, because you're trying to use one intervention in a very controlled population, like you said, in very isolated circumstance where, hey, let's take a human as an individual with preferences, let's take some experience and let's put some combination in and see how they respond. There's definitely people that I've not seen them get any benefit from it and I've just not used it. Simple as that. Like all that kind of thing. And I think that's one of the marks of being a good practitioner is remembering that there's more than one way to do everything and not everybody, nor should everybody respond to that same way. So with cupping, anything else we want to sort of hit on before we move on to the next one?
I want to just touch on the decompressive effects. So you obviously get compression around the cup, but the area of the skin inside the cup is decompressed. For me, the reason why it does facilitate healing is because the decompression, acts on the soft tissue. The blood vessels are also made of soft tissue. So if you can take some pressure off the soft tissue from whether it's a fascial compression or some sort of skin compression or whatever it may be, you're going to allow for greater expansion of the blood vessel, which is then going to promote blood flow via delivering more blood and more of a detoxification sort of process, which will then lead to your enhanced healing capabilities of the area. So that's sort of the sciencey part that I like, that I believe sort of happens on a mechanical sort of level. But there's also the Chinese medicine aspect of things. So you have each appearance of the bruise, or whether it's not bruise at all, can suggest, whether it's got a qi deficiency, which is I think it's a sort of life force. Is that what that means in sort of Chinese medicine?
My understanding, and again, forgive me to any Chinese medicine practitioners if I butchered this horrendously, but what I was explaining is that qi is that was always talk about stagnation of blood flow, right? It's an energetic thing there. You get stagnation of blood flow, and what you're looking at with the increase in obviously color through there is an area that had more stagnation. Dan, you were going to say something before. What was that?
Oh, pretty similar to what Benny was saying, but it's, I think one of the forgotten systems in the body, which I'm pretty keen on, is the lymphatic system and the effect that has. And when we think about lymphatic system, it's not pressurized and there's no valves like your circulatory system. We don't have the heart pumping, so it's almost like getting the hose or getting that final piece of toothpaste out of the tube and you're trying to squeeze it inch by inch. So it almost acts as that pump system to manually get things going again. And if you think about what Benny was saying, detoxification, your main system for that's going to be lymphatic system carrying fluid around the body. And if you look at that, it's 15 liters of lymph versus 3 to 5 liters of blood. So if we can get that pumping, it's going to have a big effect in terms of healing time too. So I think it's not one thing, it's everything, but it just depends how you analyze it really.
And that's a really good point as well. And just so people that are listening, multiple therapists can actually perform this level of cupping. So anywhere from remedial based, so it has to be remedial and upwards. So remedial, myo, physio, osteo, chiro, even podiatrists are starting to use them now a lot. So you see this method. Look, this method's been around for over 6,000 years. So it's not, I know, like my grandma would be like, oh, I used to do that to get rid of the flu. Well, it doesn't do that.
Illness.
I can tell you
It
that.
helps, yeah.
It definitely helps, but it's a big contributor. And when you understand trigger points and how they work, and then you place these cups in specific regions, the results that you get from the cupping in conjunction with a lot of other treatment modalities, which we'll talk about now, this gives us a fantastic result when it comes to treatment.
No.
So if you haven't tried it, check it out.
Yeah. Well, let's go on to the other big one that everyone seems to be jumping on board after thousands of years is obviously scraping, right? So instrument-assisted soft tissue. Traditionally, I believe we're going back to that Chinese medicine. We had gua sha, where they were using the volcanic rock for scraping. So it's something I've used basically since I started my career. And I've obviously adapted through different tools over the time. I mean, for me, I use it for two reasons. Primary reason I use it is probably hand protection, because beating your hands up on people's bodies will come and find you as a therapist. Like, if you're going to work on people's bodies all day, every day, and like I do heavy manual work, you've got to protect them. And I find the instrument-assisted soft tissue I can get similar, if not the same effect in a fraction of the time with less damage to myself. So obviously similar, again, we're trying to create a stretch response to create reductions in tone, so relaxation of the muscle. We're trying to stimulate an increase in blood flow in area to improve healing. I find it's particularly effective for both of those things, and it's something that I definitely lean on when I need to make bigger changes into a muscle region. Anyone else want to jump on?
Yeah, I think that's a really good point to make. It's all about sustainability, right? If you everyone hears the common injuries of most health practitioners and manual therapists as such, it's hands and wrists, forearm, lower back injuries. The reason why you have a hydraulic bed is to help obviously get you in a better position. The reason why you use other modalities other than facilitating the healing effect with the clients and the people we work with, it's about deloading your own hands, minimizing your own injury risk for yourself. And I know that, especially a lot of heavy, deep tissue work, and people might prefer hands. It's just like, damn, your hands are going to be shot afterwards. Your thumbs are going to be sore. So I think that's a really good point.
It is. And I use my hands probably more than probably all of you guys. But now, Benny, now you stepped that up. So, but for me, before this whole hybrid practitioner came out, we use our hands non-stop. So for us, using the tool, and there's actually some other great benefits of using the tool as well. So because the tools are a lot bigger, a lot longer, a lot thicker, a lot wider, we're getting a lot more of surface area on the actual muscles. So when we're scraping through glutes and quads and calves, we actually can get the whole entire muscle, most of it anyway, and work through those muscle fibers. And like Nathan was saying, literally we can get the same effect in half the time. So all that time we're sitting there rubbing, because of the density and the weight of the actual bar, we can get a lot more effective treatments done. And especially with bodybuilders, the main niche that I kind of treat, I've seen some fantastic results from them, and working with the lymphatic system and drying them out when it comes to comp time, like so many great results with the tool. And I highly suggest, like I've had so many practitioners that haven't ever used one before. So if you've never used one, get your hands on a bar and start practicing.
The tarsal ones are all right. They're pretty good.
Yeah, they're right.
A little subtler. And I think it's something also to add to this, and I think Mina just harped on there. There's a lot of people selling courses on this stuff. It's really not that difficult.
It's like deep tissue with a bar.
People are like, oh, you got to do this course. I'm like,
no,
do you know where the muscle is? Do you know its angle of its fibers? And all you need to know from there is the angle you have in the blade will increase or decrease the force going through it.
That's it.
After that, we're pretty much good, right? Like, don't kid yourself if you think there's too many amazing things going on. It's just
unless the course comes from Benny or myself, then go for it. If it doesn't, then they're all crap, all right?
Right.
That's usually just, there's a lot else in there, not just that.
Dan, I'm seeing he's chomping at the bit down here, Dan, on my screen. What do you got to say there, brother?
Yeah, I think similar to you. I think like the way I thought about it initially when I started was what Mino said, like covering more surface area. So there's efficiency in your treatment. Like for me, it's usually a combination. Sure, we'll talk about needling, but like needling, cupping, scraping. And you guys know I'm pretty big on the seatbelt mobilization, or like the Mulligan technique. I think for all of those, it's allowing you to be more efficient. Like I can chuck some cups on the thoracic while I do some mobs on the glutes, while I can, like you can work 3-4 areas in 30 minutes. One, which always surprises me when people come in and they say, "Oh, I saw my practitioner and they only worked on my elbow for 30 minutes. And I'm like, you know, if you understand these things, you can now work on 3-4 areas, which is more efficient. And then what you said about protecting your body. So, you know, I just think about it as levers really in biomechanics. Like you're creating a longer lever, which is going to be more efficient for you in terms of producing force, which means you're going to A, save your body, but B, like you can have a more consistent force application versus when you're using your body. It's like, what's the angle? How tired are you? Like, what's the person's shape? What's your shape? It's like, I feel like it makes it a little bit more consistent. And then similar reasons like the seatbelt mobilizations that I did on Mina when he came in. Like, you know, it's pretty heavy work if you're constantly pulling people's hips around, especially when you came in, Nathan. Like, you know, you're a big bloke. You know, for me, it's like if I'm 90 kilos, big.
No, tiny.
You know, it's hard to move people around. It takes a lot of toll on you. So it's like, well, you look at the seatbelt, it's like, it's not doing anything different. It's just like creating a different lever to have better force application, to be more efficient, probably deliver a better treatment technique, and also save myself in the process. So yeah, that's my 2 cents.
That's good. Yeah, it's like end of the day, efficiency, right? You want to provide that value, that's that quality service that people want and people will come back for, because we all work in competitive markets. So it's about how efficient can you be, how smart can you be. Like Mina and I used to have competitions on like how many things can you get done in the one session, like get it done well, effectively. Yeah. So you weren't cutting corners anywhere, but you're just
not
like
just rubbing and tugging.
No.
Yeah, that's effective, but this is a different kind of effective. But like, it's about being fast and efficient, and obviously practicing and how to mold each intervention into each other. Like, do you start with massage here, or do you start with cupping here? Does this area like dry needling? Does this area like scraping? Like, are my hands sore? Like, what does this guy want? There's a lot of different factors to take into consideration, but they all have their own place and they all work on similar systems. It's just, you know, efficiency, preference, and I guess anecdotal experience on what each thing does for you.
You guys do much of the mobilization with the seatbelt, or am I the only lone wolf here?
We learned that at uni. Mulligan's is like huge in physio, but fuck.
Yeah, it's big in chiro too. But I have to admit, like we got
I don't
taught all
use
the seatbelt mobs. I use a lot of. I'm heavy. I just use a lot of self mobilization, and then I've got the drop table, which is probably unique to chiro. So I get a facility, like I've got an assisted mob table, so I can lift areas up and drive force through with minimal stress to the body, which is I have to admit, an absolute godsend on the body, right? Like
they're pretty
having
cool.
the tools, and it's again nothing really that exciting or imaginative, but just again, it's another tool in the toolbox to really help move through.
I might get one.
And also, with joint mobilization, so this is something that myotherapy and onwards do. So you won't get this from any remedial type therapists that haven't kind of studied that aspect yet. But just so people know, it's basically literally a seat belt that we put around a specific joint and we mobilize the joint. So there's no adjustment whatsoever. So it's literally just a slight opening and closing, which is 4 stages that we do it in. So depending on the joint that it is. So joint modes is something that my therapists do as well. I love it. I think it's fantastic because we're technically not allowed to, you know, do a thrust manipulation, which is an adjustment like a chiro or an osteo.
We should probably clear that. Not technically, you're not allowed to.
No, we are not allowed to.
Mind you, if you go to your average Globo gym, there's plenty of PTs that have forgotten that.
The only reason why I say technically is because sometimes you can stretch someone and you may experience an adjustment.
But I mean, but that's not a
adjustment.
We should do that. That's not an adjustment, and that's not a joint manip, right? That's a stretch with a cavitation. Like, and that's an important distinction we should probably bring up shortly. That there's a big difference between making something go pop and actually creating a joint manipulation.
Yeah, a purposeful maneuver. I think on that, like, as we said, right, like you don't have to go do courses for everything. Like if you've got half a brain, you can look at some videos and you can learn how to do stuff. Now, what you got to be very careful of is who you practice this shit on. It's whether you're covered for insurance or not, basically, and whether you're operating within your limitations. So I believe that you shouldn't not ever do it. Like if you want to practice and you're planning on studying further, or you're planning on integrating into your actual your business, I think that you should learn a lot of different techniques, but you got to be safe. You got to learn from the right people, and you got to do the appropriate kind of courses or get the appropriate qualifications to make sure that A, it's safe, B, you're insured to do it in case you fuck it up. Like we all are very capable of doing lots of things, but it's like, do we want to do this to someone and potentially injure them? Probably not.
Yeah. Well, the other thing to remember with a lot of things is having more things doesn't make you better. Better, like it's not like more isn't better, better is better. And sometimes people just need to dial into their main skills rather than just trying to add another 100 things to the toolbox, right? And this is where we're like, if anyone's listened to us talk about before, this is why there's 4 of us from different professions. This is why we spend half our time referring to others, because we have a selection of particular skills that, you know, in the taken voice, make us a nightmare for certain people. But in that point, right, like and we're going to probably talk about in a moment, don't do needling, not because I think it's a fantastic intervention, but it's not something I've looked to learn because I have people around me that I can send for it.
Yeah.
And so recognizing that. And so like, yes, by all means, I think there's always room to add things to the toolbox, but make sure you're adding it for a reason. You're not just doing more for the sake of it, but also make sure, you know, like no one's like, especially I'm going to come back to joint manipulation. That is not something you learn off a video or a weekend course, because it's making something go pop and understanding why, how, and when it's safe is the real thing, right? Like intervention is not what I know I harp on about this, but intervention is not the role of the therapist. Evaluation is the role of the therapist. That is why you pay to go see someone, because it's the evaluation that leads to the therapy. You know, there's 1,000,001 things you can do at home. Like you can buy scraping tools now, you can buy cupping tools, vibration guns, everything. But if you don't actually know what's going on, they're all useless. And so we need to back to understanding that the reason people come see you is for the evaluation, and the treatment is the adjunct to that, not the other way around.
Yeah.
I think we just found our soundbite, bro. That was good.
Mate. Going hard in the paint.
That's good.
So do you guys want to talk, because obviously this is not my area of expertise, you guys want to talk about needling then?
Yeah, one of you boys go.
Great. Yeah. So needling, again, just to kind of cover a lot of who can do needling and what it is and when we use it. So dry needling is a technique that is also used by Myo. So remedial therapists can do an extra needling course that adds on it. So you don't actually get to do needling in your remedial course, but Myo onwards. So did you guys cover an osteo and physio? Or is that something you guys just learn along the way?
Postgrad.
Postgrad.
Did it after, yeah. Just weekend course.
Yeah, so if anyone's looking at doing a myotherapy, so we spend a good 12 weeks on myofascial trigger pointing. So myofascial trigger pointing, so obviously myo means muscle, the fascia, so we basically release trigger points or myofascial trigger points through the effect of dry needling, through the use of dry needling. So the reason why we do it, so a few things why I do. So generally when you touch a trigger point, it can be quite sensitive. So before I kind of start an area, I always dry needle a certain spot. What it does, it desensitizes the muscle. What does that actually mean? So it removes all the pain away, and that way we're able to kind of treat and continue the treatment. So what it actually does, so you've got fibers within the muscle, and when we dry needle, we get a trigger, right? So that trigger then basically is twitches the muscle. When that muscle twitches, it releases. So similar to how we do trigger point therapy with our hands, or we do scraping to release trigger points with the bar. This is one mode that we use that releases trigger points as well. But myofascial trigger points is what we call it.
Yeah, that's a good point. I think the way I explain it is the easiest way to understand it from a client's perspective is that it does very similar things to what a deep tissue massage would do, but rather than pushing on the skin, use the needle to puncture deeper into the dysfunctional bundle of tissues, like the muscle knot or the myofascial trigger point, whatever that may be. So, and this is some extra stuff that dry needling does, because it does inflict obviously damage further into the muscle tissue or the bone or the tendon or wherever you're needling, because you can needle lots of different structures without actually making them worse, actually promoting healing. So you get a deeper and a more accurate inflammatory response, I believe, which leads to a better healing response long term, because there's only so far you can push with your hands. So actually using the needles, and they're very specific, you can actually get to quite deep problems, you know, depending on the area, which will be, again, more beneficial than the hands-on techniques or cupping, because all that stuff is on the surface. So I find that dry needling to facilitate a healing response is, again, one of the really effective things. And I love doing a bit of needling followed by a bit of cupping, because you get that, you know, deep inflammatory response followed by, you know, a pressure of blood trying to pull through the tissue and create that detoxification process, as well as, you know, just really promote that vascular supply to the tissue that obviously where the cup has been on. So I find the combination is really handy. Ooh,
Nice. Anyone? Sorry, I had to
quiet on that
jump
one.
off there. I'm just running a bit of admin in the background. Any of the boys? Anything else on needling?
Dan?
No, to be honest, I don't use it as much as you boys. I think you guys have summed it up pretty well.
Yeah,
Nice.
and like, sorry, bro. We
No,
need to
go, man.
wrap it up soon. I know that. And
No,
like
go ahead.
Mina alluded to before, there's different for each profession and the amount of study you've done. There's different requirements that you need to do to be, I guess, qualified to do that. So I think for physios, it's a 16-hour total time that you need to learn how to do dry needling. That's why it's a 2 or 3 day course. For other, I think Myers or remedial, I read 80 hours or something like that.
Yeah.
Or more, so I'm not too sure. But
Yeah, so
depending on
depending on the course, you do about 3
Yeah.
months worth it, but you need about, I think, 25 clinical hours, and then I think another 40 hours in, like doing it with a supervised therapist. Yeah,
it's a lot.
which is good. I mean, and
Safe.
yeah, it's good. But the best thing that I encountered when doing my needling course is it really refines your anatomy. So please know and understand your anatomy, so because you are sticking specific needles. Now, these needles, good to understand these needles. These needles are hypodermic needles, which means there's no fluid or anything that comes out. They're literally just a needle it's a pin, basically.
Acupuncture type needle.
Yeah, acupuncture type needle that we use, and that we palpate. So basically palpate certain trigger points within the muscle fibers, and then you'll probably see some videos on my page or Benny's page of Instagram, doesn't take them off. And you can see further techniques around how we do it and why we do it.
Yeah. We need to do a part 2 to this, I think.
Yeah, man, that might be the way to go. But do we want to hit any more? Or are we going to call it in there today? What do we reckon, boys? Get some excitement.
Call it in, I think.
I think we'll call it in. I think
We're
we'll
gonna do
deep
part
dive
two.
on
Boring a lot of
part two.
So I think there's a fair bit going on there, right? So I think, part 2 might be a good option so people aren't overwhelmed and they're not scrolling through an hour's worth of random stuff. But there's some really important stuff there, right? Like different therapies, but they all have a common goal, and that common goal is to get results for people. Like I think we harped on each one, it's the best option for your body, but also the person in front of you, and figuring out how to make that work. So that's my sort of passing remarks on that one. Anyone else, anything to add before we sign off today?
I'd be keen to go through Maligan, but I reckon that leads us into part 2 where we could maybe go mobilization, manipulation, and then some exercise description.
100%. All right, lads, pleasure as always. Everyone, remember, make sure you're throwing those screenshots up, tagging us in. We love to see them. And always leaving us a 5-star review wherever you get your podcasts. Gents, it's a pleasure as always. I'll see you all soon.
So, yeah.
Thanks, right.